I'm a mission-driven healthcare innovative leader.
Did you ever feel like your lived experiences gave you kind of an edge others did not have?
For 20 years, I was there, a large behavioral health nonprofit organization. At the end of the day, the idea was, how can I help as many kids that were growing up in a way that
You were abused and neglected as a child and grew up in a child welfare system. And when you later stepped,
I didn't join the Army just because out of a sense. I started in social services because I was in the infantry, and
I always saw there was at the end a kid who was getting the service, and this kid, how do we make sure that we get services to kids? And that was a big part of Hello and welcome to the Uprising Show. And today I have a special guest, Roy. Welcome to the show.
thanks so much for having me, Vivek.
Roy, I know you are man of many trades. So give us a 1 minute brief intro before we go into more detailed questions through and uncovering your journey. So just little brief intro.
Yeah, for sure. Well, I'm a mission-driven healthcare innovative leader, and I'm presently the president of Life Chef Health, which is a nutrition-based health ecosystem.
And I was going to say, like, Life Chef is incredible because I explored and I was looking at this. I have a lot of questions. We'll go into those details later, but let's just go back in time first. So, obviously, you have shared pretty openly about that you were abused and neglected as a child and grew up in a child welfare system. And when you later stepped into leadership roles, especially at Legacy, did you ever feel like your lived experiences gave you kind of an edge others did not have, or that made things more harder to navigate for you?
Yeah, no, I think definitely it gave me an edge. It also came with a slew of problems. Legacy, right? I scaled Legacy from very small to very big. For 20 years, I was there, a large behavioral health nonprofit organization. Really, what growing up the way that I grew up gave me a fundamental understanding of who we were working with, right? We were working with me as a kid, right? Like a pissed off kid, right? A kid that was going to do inappropriate and challenging things. And so at the end of the day, the idea was, how can I help as many kids that were growing up in a way that I did? And then it exploded and grew into so much more than just the kids that we were trying to help.
Yeah, and of course, you also served in Army, and we are just coming from the Veterans Day, so thanks for your service. And I know that you started working in social services while serving in the Army, which is rare or a very rare overlap. So was there a moment during that time when you realized that, helping others was more than a job, right? And that is what going to be your life's work now moving forward?
Yeah, well, I didn't join the Army just because out of a sense of, pure patriotism. I got into college and had no way to pay for it. And so, right, I was poor. And I started in social services because I was in the infantry and something called EFMP, Exceptional Family Member Program, right? And so I started volunteering, not because I had this huge heart, right? But because I wasn't getting shot at and I didn't have to be in the infantry for that 6 weeks. I fell in love with the kid that I worked with, right? A young kid named Zach, who was nonverbal, had an intellectual and developmental disability. I didn't even know what that was, right? I was this 18-year-old kid that thought I was invincible and I was changing diapers. And that kid really changed my life because I got such a sense of fulfillment and purpose from that. And I was young and dumb. So I was like, okay, I can really help. I want to spend my life trying to help kids and people that needed help. And so that's what I did. Minute I got out of the Army, right? Looked for an opportunity to work in the system, work direct care, right? And with at-risk youth for many years, and the rest is history.
Yeah. And I was going to say, like, I was telling you that I worked in home care, and the population that we were really serving was the kids. It was very critical care, pediatric. And I'll tell you, like, there were days I will feel like really, really demotivated how system worked, how the care works. It's like so many home care is not an easy business, low margins, and then you have to keep everything to get the service. The only thing that kept me motivated was also that I always saw there was at the end a kid who was getting the service, and this kid is like, sometimes these kids are on GTU, can't even get food by directly, and they had a lot of learning disabilities. And we always focus focused on honing it on how do we make sure that we get services to kids. And that was a big part of I worked in that industry for more than 2 years. I would say that I would have called out before 6 months if if that would be the motivation.
Yeah.
But I think that's where I was. I think that was a great motivator for me too. I could totally relate to what you were saying. So you led legacy treatment services from I think 150 children to a year to over 20,000 people annually. That's massive scale, first of all. So that kind of scale is very rare in nonprofit behavioral health work. Very rare stories you hear about this. So how that happened and what worked, I guess.
Yeah, so I think simple fundamental principles, right? So first, right, we had a mission, right? I still remember Legacy's mission to change the social service and behavioral health care outcomes for people of all ages from surviving to thrive, right? And so one was stay within your mission. Is this what you're doing? Number two was be brave, be bold. In New Jersey, there were a bunch of RFPs, right? Requests for proposals, right? And companies, nonprofits would often go for one RFP, right? But there were 5 potential ones. And so I was like, no, anything that we're going to do, we should do right. What most folks get wrong on the nonprofit side, or what many folks don't understand if they're not in nonprofit healthcare or behavioral healthcare, is that those function like traditional businesses, right? They're well-intended businesses and they might make a choice so that they're going to fund services to help people that aren't financially sustainable. So you're going to let your winners pay for your losers. But in order to achieve scale, you have to, yeah, singles and doubles are great. You have to go for the grand slams, right? And nonprofits must grow at a pace that outpaces inflation, right? And it's not just CPI, right? But it's any aspect on the expense side, right? That grows year over year. So every year I was combating, 20, 30, 40% increases in healthcare coverage, right? And and the principles were simple. Stick with the mission, right? If you're going to do something, you should do it at maximum capacity that the organization can handle, right? And then, of course, I didn't do anything, right? It was my team, right? Like it was investing in people and being authentic and generating these lifelong relationships that enabled a culture of excellence that measured performance in both how effective we were at actually meeting our mission and helping people, but also making sure that we were financially sustainable.
Yeah. I always say that sometimes to even my paying clients that, hey, you come with, you understand that even the most, even for NGO, you need a sustainable business model. And then they're like, so I tell them then obviously in a good way to say that before you put any money, I want you to understand your business model is clear. Because at the end, this is a marketing channel that I built for you. It's marketing channel before you put money here. I want to make sure this really is your fourth marketing channel through which you will get the, customers or your business goals. So it's still, I guess one question I have here is for you, you mentioned this, that you got to keep up with inflation. You got to keep up with, other reimbursements, how things are changing. But even despite that, and personally scaling a few of other companies where I have worked, the challenge in healthcare is also the quality of service or capacity. What was your, I guess, mantra there that worked? Because to keep up with that, it's a good method. Yes, we want to keep up with this, but was there any hurdles on your side to make sure that capacity or quality bottlenecks are not there while you're scaling to that level?
Yeah, I think the whole thing was a hurdle, right? Like when you're in an investor backed platform, I describe being in an investor backed platform like owning a boat. The 2 good days are when you get funded and you start, and then when you exit, right? And in between, you're just solving problems, right? And different problems at a different evolution in the size of that platform. Nonprofits are never done, right? They're never exiting. And all of healthcare shares this common attribute. It doesn't matter how good you are at helping a patient. It matters how good you are at helping one patient at a time, right? So you need to make that replicable, right? And so, my goodness, you could fill a crater in the moon with the number of mistakes and hurdles that we had, from regulatory to staffing to cash management, right? Those are all traditional challenges that were faced. And unlike in an investor-backed universe, there was no place to go to to, right? Like you didn't get, we couldn't go to the board and say, hey, we need you to release funds to us, right? You actually had to generate those funds, right? And so for us, I think really the success at Legacy and then eventually Wood Services, right, which was the parent organization, was pretty simple. Was when we had multitude of service lines, right, dozens of service lines, right? How are we measuring success? What is the clinical efficacy of what it is that we're doing? Own the mistakes and your errors one at a time and systemically, and then just constantly be correcting and course correct. What often gets lost, right, in the convergence of healthcare now, whether it nonprofit, for-profit, health system, tech, PE, VC, is that healthcare is a lot about relationships and it lasts forever. And so if you maintain those relationships and they're transparent and you are actually delivering on what you're supposed to, then your organization will be successful over time. And if you can't deliver those outcomes, then your organization won't be successful, right? And then if you can't manage those relationships, your organization won't be successful.
Yeah. I always say, I remember that when you work at venture backed companies and as the company's evolving, sometimes the pivots are in completely opposite direction, right? And I was, without naming, of course, in a situation one time where we started as a SaaS platform. So we had the Silicon Valley investors, nothing against them, great investors, right? But they carry like a different kind of thesis, right? The SaaS software, it's like 90% margins. That's kind of how they think about stuff. And then you pivot and become more like a healthcare organization and trying to build more healthcare operations, then your margins are not like that, right? So I always say, like, have the heart when you're working in healthcare, not just think about the tech, and only then you can really build. And this is where I think resonating with me when you say the relationship part. Like it's a relationship business, either with your customer or even investors, right? In that way,
Yeah.
and it gets really interesting when we start in healthcare from tech versus the person at the end. I think it's very different views, and thankfully for me, it worked out nice. But I had my own struggles, just to say that.
Because it's the last thing that a patient wants to hear, whether you're going to a doctor, a therapist, a dietitian, a surgeon, is that their number one concern is that they have a 90% margin. What you want to hear from your healthcare company is that they're really good at taking care of you and helping you get better. And the better they are at that, the higher the margins actually will be in the end. But the other part for invest one of the best attributes of nonprofit organizations, I think, that is counterbalanced to investor backed, be that PE or VC, is that nonprofit organizations are patient, right? And so, many different investors and investment concepts preach, right, ESG and patient capital. But healthcare is one of the few large scale, TAMs and marketplaces that money can't expedite the speed at which healthcare, not always, right? Because the level of bureaucracy that occurs, and in a good way, sometimes the level of regulatory compliance that is necessary, right, slows down the speed at which you can scale and grow. And also make sure that healthcare is not designed to be the most profitable business, right? Healthcare will always measure and always should measure itself in terms of its clinical efficacy and outcomes and how we've been able to help people. And, right, they go hand in hand. And then comes the financial excellence and success, because anything that's worth building that's going to help people at scale has to be financially successful in order for it to maintain over time.
Yeah, I see what you're saying, but I also have the other point of view that I hear from the people in healthcare is like, health is the most important asset. So why don't we get the most money if we provide those services, right? Or
Well,
the
I believe that though. Again, they're not mutually exclusive. You should make as much money doing something in business, in any business. You should make as much money doing that business as possible, right?
Sure.
Like, of course. Now, what you decide to do with those proceeds, whether you're giving it back to the community or helping patients or advancing and scaling, or using distributions or, tweaking EBITDA in order for you to get the exit multiple that you want, right? Or you're scaling your ARR. Each one of those has separate and distinct circumstances, right?
Yeah. I hear, and I've been into these conversations a lot this year, especially. There is this, of course, distrust in insurances, how it works. There's diminishing at least trust in the system that, hey, we have a sick care system. And if you talk to people, especially in all metros or even middle to upper class, and ask them like, hey, your views, and they'll tell you like, yeah, I started to treat my health insurance like a car insurance. When I'm critically ill, I will care about using this insurance. But for other times, I want to have a doctor who gives me more time, and I'm fine paying membership or whatever those models are to those for primary care, preventative care with a doctor who will give me time, make sure I don't get sick. So what's your take on that? Because I'm conflicted just as I am, because there is this question of access with it and how can we get it to the grassroots levels. And I feel like you are the person whom I really want to ask this question, who's been in those trenches. What's your view? How are you viewing this? What's your take on what I said, I guess?
Yeah, for sure. I mean, listen, I do advocate and spend a lot of time on health equity, right? And access to care is tremendously important. I think, I don't know if my view is commonplace or not, but I really view healthcare as a marketplace. I don't know anyone, regardless of their socioeconomic status, right? Or whether they've got fully funded insurance through an employer, if they're independently wealthy, right? Or, they're on Medicaid. I don't know anyone that doesn't contribute to their health insurance, right? So this one, I abandon the premise that somebody else is paying for my health care. Everybody has a copay, co-insurance, right? Direct to consumer, right? You can Amazon One, you can go on Amazon One. It was the birth of retail health was, right? Okay, how do I make this really accessible? We're seeing now in the US, right? Rural health transformation program, right? You're looking at, right, a decimated rural health hospital system that is now going to get funded, trying to spark innovation to be able to address the most vulnerable populations. At the end of the day, what I say is very simple. I think I view healthcare in the United States as socialized medicine. I believe that the highest dollar spent is, the general rule for insurance is the 80-20 rule, right? 20% of your coverage is responsible for 80% of your spend. So significant portion of the population is on Medicare, Medicaid, or a combination or both. They're dual eligibles, right? And so where the real high dollar spend exists is not in the middle there where we're contemplating these commercial insurance or self-funded insurance plans or reference-based insurance plans. And so for me, what I say is very simple. How much are you going to spend on healthcare in a year, right? And when you do that math, I hate this reactive notion. I think but again, it's no different than your risk tolerance for like investing or something, right? But I hate the notion of, okay, well, I'm going to ride or die with this affordable plan because I don't think I'm going to need that coverage. Well, I don't like that idea because it's the hospital stays, right? And it's those, in-depth surgeries and that really bankrupt folks, right? Medical bills are leading cause of bankruptcy, right, in the United States, right? So there's no question it's just a mess, right? So if you talk to an insurance company, they'll tell you that they're losing money hand over fist and they're reporting to their shareholders. If you talk to providers, right, they will tell you that they can barely eke out an ability, right? The running joke is MD stands for much debt, right? That they can barely eke out a living. And, I live in New Jersey. You see a mass migration of graduated medical students that leave because they can't afford, right, the cost of living in New Jersey, right? So, and then of course you have the patient, right, the client who's saying, oh my goodness, I'm paying thousands of dollars a month and I'm not getting anything for it. And somehow when I go to the doctor, I still end up paying more money out of my pocket. So I think you do it like you do any other budget, right? Like a housing budget. And you go, okay, we have $30,000 or we have $20,000 or we have $10,000 for healthcare. And what's the best way for me to deploy that capital in order to meet my needs?
I like that perspective, because I think a lot of time people just I think giving a name as marketplace will help people get aligned that the way to work this is obviously going to be some people will pay more than they use, and that's fine. That's the dynamics of marketplace. That's how it works. And I think people just get mad when you tell them about this. It's just such a difficult topic to just like something people is just like, no, I don't get sick or whatever. I pay this much, and then they don't care about anyone else. And that's not how it can work. Just just because society doesn't work that way. So, and this is why I like quoting you as marketplace, being that and understanding that how marketplaces work is the fundamental is this. That's how it works. It is 80/20 rule. That's how you got to make the math work. And I think that's where I think we need more people to talk on this, how to talk about this topic. I think this is the best way I have heard in this year, I would say.
And of course, we're at the fundamental responsibility of a civilization, right, is to take care of its people. So, right, so and to take care of the young and to take care of the old because they're incapable of doing that themselves, right? So that's those are sort of the barriers where me personally, I'm like, yes, we need to fund true healthcare on Medicaid, we need to fund true healthcare on Medicare, on the Medicare side, right? And then in the middle is where we can sort of figure out what it is, and we're taking steps. It gets stuck in political nightmare across a spectrum, but at least we have payer transparency now, price transparency. So now I don't have to worry about getting a $1,200 bill from a lab for my blood work because I went to the wrong lab because my insurance changed and now that lab is no longer accepted, because for $51 I can go on to Quest's website and I can get or for $29, I think I looked the other day, it was $29 for like a complete blood. I'm not a doctor. Nobody needs to comment that's not there. Yes, there's other tests, but my point is you can go out and purchase a blood test for yourself.
Sure. Yeah. Now let's talk about Life Chef Health. So it is really a concept of food as medicine. And I guess talk us through what drew you to this space specifically and what are you hoping to solve through nutrition driven care?
Yeah, great. I'm really happy that you asked that, Vivek. Ultimately, what drew me to Life Chef Health was this notion that I found in my time in healthcare across a multitude of platforms, and particularly in behavioral health, that there was this preponderance of chronic care conditions, right? And it wasn't just for the people that we were helping, but honestly, was for our workforce too, right? So, right, and you go right, which I was a part of, right? Whether you're a manager and you're sedentary, or you're a direct care worker and you're working two jobs and you're working 16 hours a day. But what happened was, we had very young people and folks as they were getting older with us and they were getting very sick. And when we looked at, we would do normal things like a weight loss challenge, right? And we would bring in like a healthy chef to try and teach kids and staff how to cook and prepare appropriate meals for themselves. What drew me was that Mike Korsky had found, and an originating team had founded Life Chef Health. We had met through a friend, and he was telling me about what they were doing. And I said, I hadn't really looked at the clinical data associated with food. We say food is medicine. That's a very, wide ranging, right? Now everybody's saying they're FIM, right? And, a healthy choice meal is FIM, right? And Meals on Wheels is food is medicine, and nothing against anybody. But when you look at the clinical research, it was really apparent, right? That over the past decade, it's been replicable time and time again that we're able to reduce hospitalizations for chronic care conditions. We're able to improve biomarkers and healthy outcomes for some of the sickest people and the most vulnerable populations, because those two things tend to go together, right? And we could heal people through food. And I thought that was just such a cool concept, right? Because from my little perspective, so I'm not diabetic, right? But I was pre-diabetic, right? And I would go to the doctor and I would get my blood work done, and he would go, "Hey, we got to get this under control, right? Or I'm going to wind up putting you on medication." And I'm like, no, I don't want medication, right? Because I start by reading the side effects. And so what would I do? For 30 days before my blood work, I would be my most healthy self, right? And I would eliminate, right, whether I was doing the South Beach diet, Mediterranean, or I was going keto, right? But whatever it was, I was reshaping my own health outcomes through food. And so for me, that was a unique and innovative approach. And then I started to think about it and realized that much like behavioral health, I always used to say, right, if you live long enough, I can't promise you joy. I can promise you that you're going to need some behavioral health help. Just in the process of life, you're going to suffer traumatic experiences, and it would be really helpful to be able to get help during those times. And for me, food as medicine was the same approach. Life Chef Health was the same approach. It was registered dietitians that were establishing a relationship with patients to be able to teach them about food, and then creating design medically tailored meals, right, that would actually deliver those healthy outcomes for those patients that were listening to the registered dietitian. And we launch remote patient monitoring next quarter, and it's really about the data and attribution and what proves that. But for me, the simple premise was I think I can actually engage with vulnerable populations and have meaningful impact simply by establishing a relationship with patients through a registered dietitian and having them eat fresh medically tailored meals.
And as of now, currently, can people just directly go and order, or is it through hospital? How the distribution work on your side?
So yes, yes, and yes. You can go to lifechef.com, lifechefhealth.com. You can schedule an appointment, a telehealth appointment with a registered dietitian. You can, once you create an account, you can also craft your own meals. One of the things that makes Life Chef, or one of the attributes that makes Life Chef Health so unique, is that it's hyper personalized. So there's 78 different individual items, right? And then that potential for 40,000 different meals. And each component of the meal, one protein, right, starch, vegetables, right, represents its own, is in its own tray. So it's interesting. I did my own food journal, and like I eat the same stuff. Most people eat the same stuff all of the time. And I see all of this data on medically tailored meals, and there's a bunch of small, medium, and large folks that are out there that do this. But one condition for you to get the clinical outcomes and attribution that you have when you have medically tailored meals are people have to eat them. They have to be good, right? So yeah, totally accessible. It is an emerging market from a reimbursement perspective. About 65% of Medicare plans
Mhm.
reimburse for some form of nutrition. You have a bunch of 1115 waivers, which are innovation state Medicaid grants that reimburse and provide coverage for it. And we have a pretty solid core group of the sandwich generation, right? Of which I fit into. You know, from a business perspective, you call it DTC, right? They're my father-in-law, who I love to death, is 79 years old. When I send him Life Chef Health, he's really healthy. And when I don't send him Life Chef Health, he's Burger King or Jersey Mike. That's pretty much us in a nutshell.
And I guess something like this should be like mainstream, right? Like it's like when I think of something like this, considering it's very hard to fix our food chains. So I almost feel like a solution like this is you should be competing against Factors of the world or whatever meal services are
Right,
there.
sure.
So do you see yourself as competitor to these companies or
One, we don't view ourselves as, certainly from my perspective, we don't view ourselves as competitors to anybody, right? There's more than enough people that need medically tailored meals. Our meals are unique in that they're medically tailored, right? What ends up happening, and we get into this a lot in healthcare, but particularly in the food is medicine space, is because it was born out of health equity and because of the social determinants of health initiative, people often confuse medically tailored meals with SNAP benefits and entitlements. But those are different things, right? So those are different aspects. And so what Life Chef Health is really designed to do is improve your biomarkers and your healthy outcomes, right? And everybody should be entitled to that. But we target specifically chronic care conditions like prediabetes, diabetes, rheumatoid arthritis, right? And so we get referrals from doctors refer to us, we'll work with our registered dietitians. But we have plenty of folks who find us on the web and go, okay, do you deliver towards us or not? And in many respects, I parallel to where behavioral health was as an emerging market. 20 years ago, behavioral health had a few codes and it was thought to be a poor person's problem and it was addressed by community health centers, right? And now, fast forward 20 years later, post COVID, behavioral health is a universally accepted intervention. It's a high dollar, high expense component of healthcare. Suicide is third by 2030. Suicide will be the third leading cause of death globally, right? And so, from a food as medicine perspective, we're about 10 years down the line to where behavioral health was. And so those folks that stick it out and are tried and true, right? And are able to maintain as these 1115 waivers start to sunset and plan adoption becomes more significant, I believe we'll find medically tailored meals are universally reimbursable for chronic care conditions or leading up to chronic care conditions because it's super cost effective. And it's a wonderful off ramp or alternative to the GLP-1 phenomenon. right?
Yeah.
Because we can mimic those results, no side effects from carrot.
Yeah. And also, I think it's measurable in a more tangible way that meals were delivered, meals were consumed. Here are the biomarkers. So I think it plays in payers' favor. I mean, they would love to have that kind of data, right? And
Well,
so,
and right, starts with the dietitian, right, where they've established a relationship, right? We have the qualitative review, right? To your point, we have the widgets, right? Were the meals crafted? Were they delivered? Right? Then we have the actual biomarkers when RPM kicks off tying to it, right? We'll be able to see live how the food impacts. But you already know, right? Common sense tells us that, right? The best parts of healthcare are just simple and understandable, regardless of whether you're in healthcare or not. And we know if I go out and I have a martini and a cheeseburger and fries, right? I'm 50. I'm going to feel like crap, right? And if I have a piece of salmon and some vegetables, right? And hydrate throughout the day, I'll probably end up hungry or, right? I'll feel unsatiated, but I'll have a ridiculous amount of energy and feel great.
yeah, wow. I actually, after learning more about, everything that Life Chef is doing, I feel like it needs to be everywhere. It needs to be more, right? That's
You say that to all your guests. You say that to me.
best way to get your I feel like it removes, like, as a consumer, I don't want to spend time in knowing what's good, what's best. I want, like, some place where it's already done by dietitian and people who knows what to actually be fed to the people, either based on treatment or either as a play for to prevent those treatments, right? So you tell, and then that should be everyone's go-to meals to do it in daily habits. That's how it should go. And that we will already see so much of our healthcare spend in the right way.
And you don't have to be perfect. One of the number one questions that I get from folks are, right, well, what happens if do you have to only eat the meals? Or it's not reasonable to expect that you're only going to eat those meals. One, try the meals. I'm telling you, right? It's no different than the broccoli or the chicken that you bake at home. It's the same thing, right? But of course you're going to step outside of that. Of course you're going to do that. And the truth is, most people don't have the time, the resources, or the energy to prepare healthy cooked meals all of the time, right? So the notion of being able to have your meal in 2 minutes, right? And you go, okay, this is good. And plus you have choice, right? And so we see clinical efficacy if we can get 10 meals, right, across the course of a week, in 30 days, you're going to actually see a difference. In 60 days, you're going to see substantial difference. And by 90 days, you'll actually see the A1C formally drop, right? You'll see about a 4% reduction in body weight based on where you're at. You'll see your cholesterol drop, right? And again, I wish I could tell you that this is super innovative, but if anybody in your family or your friends was ever diagnosed with type 2 diabetes or is pre-diabetic, they've done this. Many people
Yeah.
do this for themselves.
Yep.
And so now they might not meet with a registered dietitian who's not really there to hold them accountable. They're there to support them, right? Like, nobody's getting chastised by a registered dietitian at Life Chef Health because you decided you were going to have a Big Mac, right? Like, instead it's about understanding the implications and how can we make lasting behavioral change. But we take someone who's been diagnosed with diabetes and they live their best life, and all of a sudden my doctor says that I'm an ideal patient and that now I'm not going to need to be on insulin and I can maintain this, and away we go. And then catch up with those individuals over a period of time later, and they're not always doing the same doing as well, right? And so if we can make it simple for folks and easy for them, then there's a greater likelihood that they're going to stick with it over the long.
Sold. I'm going to try this. Anyway, I'm not diabetic, but I'm just going to try it because
No, yeah, of course.
it's just a fabulous idea, and this looks like, how big is the operation right now, and is it more like on the back end? It's more like a commissary model. How does it work?
No. It's a commercial chicken. It's not a commercial chicken. It's a commercial kitchen. We have a commercial kitchen. We have an executive chef, right? And so basically, orders come in, right? We ship out twice a week, and orders come in, custom each custom cook and design each patient, right? And then every week, and there's some IP around the process, and our packaging is exceptionally unique. There's a QR code that gives macronutrient level for each piece, right? And really what makes us unique is that we're the only scalable. One of the aspects that makes us really unique is that our food is fresh. It's not frozen ever. And so and we're scaling, right? And so no, it's a lot, almost like a restaurant, right? Like a commercial kitchen where there's line cooks and an executive chef, and they see the orders that come in, prepare them, and twice a week out they go.
Yeah, really fascinating. Is this delivered all across the country?
No, right now we've got registered dietitians in 32 states, and we're limited geography wise, at least through the end of 25 to like the 7 mid-Atlantic states, but we'll scale nationally over time. That's the goal. Just we need to make sure that we have a sufficient patient base and established reimbursement model to be able to ship everywhere across the country.
Yeah, we'll put a link in our show notes so people can try it out, place order, find out what where all places they can get it delivered. Well, this has been great. Thank you so much. But before we conclude today's conversation, I like to do a quick, fun, quick fire round. Just whatever thing comes to your mind, that's your answer. Go for it, and then we will conclude the episode and conversation. If you're ready, I'm ready to shoot you with the first one.
Do not have high expectations. Yeah, yeah, of course. Anything.
A piece of advice you would give to your younger self fresh out of army?
Don't take your health for granted. I used to bench press 325 pounds and run a 6-minute mile, right? I was in the army, I was in the infantry. And now I'm exhausted if I drive a six minutes in a mile. So don't take your health for granted when you're young.
Yeah, my late grandfather will say that treat health like meals, cook it every day, not make, which is what it is. So,
Yeah, for
uh,
sure.
one thing about behavioral health, most executives still don't get it.
I would say that the most important aspect of what you do is your workforce. The people that you work with every day, they're charged with helping people and saving lives. And in order to help people, you have to be present and you have to be happy. And that only happens in a culture where people feel valued and appreciated.
That's a good one. What's one thing people misunderstand about you or that you rarely get asked?
I would say the number one thing that people misunderstand me is that they believe that if you worked at a nonprofit organization or that you were the CEO of a nonprofit organization, that you are financially bereft and believe in the notion that a company is supposed to have a zero balance budget, because that's not how healthcare nonprofit works at all. The folks typically misunderstand that. If I had a dollar for every time somebody told me, well, that this isn't a nonprofit, it's different here, I would have at least $10.
Yeah, this is where my point goes to, like, hey, to run an NGO, you need a sustainable business model.
Yeah,
If you don't, you can't figure that out, then it won't work anyway.
that's exactly right. No money, no mission.
Yeah, exactly. Well, this is fabulous for your sharing your journey and giving us more insights on especially life chef. If people want to get in touch with you, what would be the best way where they can find you?
Sure, they can. I'm on LinkedIn. They can always email me at royale@lifechef.com is great too.
All right, we'll put the email also in the show notes and LinkedIn, Roy's LinkedIn, so you can get in touch with him. And once again, thanks for your time, Roy. This was great to learn, and I really think this the food from Life Chef needs to be everywhere. That's what it is. So this is good. Thank you for sharing everything.
I can't thank you enough. I really appreciate the opportunity to meet you and understand what you're doing here. It's amazing.
Thank you.